Never thought it would be so serious.
Yeah, I thought Shane only had a cold.
I remember when Trish had it. She had this nagging cough, fever, and being very fussy. Had to have nebulizer treatments daily 4 times a day. Had to do the poundings. Had to go to bring them to clinics for follow-ups. Stayed up most of the nights.
Yeah, I remember when Shane had it too. He had really rapid breathing, and he had short of breath and high fever. We stayed up all night too.
Mm-hmm.
Brought him to the clinic. They sent us over, and we ended up in the hospital for 10 days.
RSV is a common virus that causes colds, and most people who get it have a cough or runny nose. But children, especially young babies under the age of 3, can develop severe breathing problems and require hospitalization. RSV is primarily spread by contact with nose and mouth mucus. Doctors usually see RSV cases in the fall and winter, but cases have been seen up to early June. In Alaska, the number of children hospitalized each year with RSV is 10 to 50 times higher than the general U.S. population.
RSV infections are very common. In fact, all of us get RSV. However, very young infants, especially those under 6 weeks or 2 months, are at a much higher risk for being very sick with RSV infections. Whereas we might get a cold, a very young infant with RSV is at a significant risk for needing hospitalization.
Stuffy nose or runny nose? No stuffy nose. How about feeling sick, weak, or tired? Fever, chills?
Still
the same?
Mm-hmm.
Okay. No change.
We used to wear us out. We have to give them a nip or monitor them at home, at night, early in the mornings. Stay up with them when they cry. Make sure they're breathing good. Give them nip treatments, do the pounding. Even they don't want, even they want to sleep, we have to wake them up and do the poundings on their chest and back.
The symptoms that Shane had were like a regular cold, and he had high fever and nagging cough, and his chest was rattly, short of breath, fast breathing.
The RSV, I think, was the one that scared me a lot, especially because several children had their lives had terminated because of that, as a result of that. And it created a lot of anxiety when we found out that it was RSV.
I got kind of scared because that was the first time he had to be admitted. I had them explain to me what RSV was. He had to have those heart monitors, I think you call them, and that where you breathe through his nose, IV on him. And his temp kept going up and down, and the way he breathed and wheezing on his lungs. I was scared.
Back in 93, 94, there was an outbreak in our village. So we saw pretty much a lot of RSV here.
There's been a number of deaths due to RSV, probably in the whole country, about probably close to 4,000 infants a year die of RSV. In Alaska, there's a few children every year that die from RSV. Back in about 1988, we had a storm of infections due to RSV in infants, when all the hospitals in the state that we were dealing with, including those in Anchorage and the private hospitals, were crowded. It almost required a energy of everybody getting together to decide what we're going to do with the next patient that became ill with this and needed hospitalization. So we became aware about in 1988 that RSV was a big problem for infants in Alaska.
Seeing these high numbers of RSV hospitalization and the high rate of infection in western Alaska, a study was undertaken by the Centers for Disease Control, Alaska Area Native Health Service, the Yukon-Kuskokwim Health Corporation, and Johns Hopkins Hospital to determine what the actual rate of hospitalizations were in western Alaskan infants and what the seasonality of infections were, and also what factors increased or decreased an infant's risk of RSV hospitalization.
The 4-year study found that the following would help decrease chances of an infant getting RSV: hand washing by those around the baby, breastfeeding, limiting baby's contact with others, and keeping the baby away from a smoking environment.
Well, the positive effects of this study, first of all, have verified that breastfeeding is indeed protective. This has been suggested in other literature, and it's been shown in this study that the infants that are going to be breastfed from birth are less likely to get the disease. The second thing is that if there's a lack of exposure to cigarette smoke, that these children do better. They do not get as severe a disease. Third thing we've noticed is that young infants are likely to get the disease much more frequently than any other population. So infants that are a month or two of age are much more likely to get the disease. So those are kids that we could focus on in protecting. Other things that can contribute are crowding. We know that in crowded situations, infants are more likely to get infected. And particularly exposure to other infants or children or adults even that have respiratory symptoms if we know that they are having symptoms at the time. And probably the last thing that we often forget about is hand washing. The virus can be spread by hands, and particularly if one individual gets the RSV virus on their hands and sticks it in their nose or their eyes, they're likely to become infected and then can spread it to the next person. So one way of carefully protecting a child against it is careful hand washing.
Everyone with a newborn baby should practice good hand washing. And when there's visitors in the house, ask them to wash their hands before they see their baby. And not to have too many children in the house, because a lot of visiting goes on in the houses when there's a new baby. And avoid going to big crowds like basketball games. That goes on a lot in the wintertime in the villages here. And bringing a 2-week-old baby to a basketball game gives that baby a chance to get RSV. Keeping your baby at home is safer.
None of these is a guarantee that a child will not be hospitalized, but these are all interventions that parents can take.
We as parents should do all we can to keep our kids healthy and strong.
The RSV study investigators from YKHC Arctic Investigations Program, CDC, and Johns Hopkins University dedicate this video to the children of the Yukon-Kuskokwim Delta and thank the parents of children who participated in the RSV study. We hope that the information learned from this study will help us work together to reduce risk of serious RSV infections in young infants.